Welcome to the Dr. Izzy's Medical Podcast channel.
Question: what is the mechanism of action of amantadine in Parkinson's TX? Answer: triggers release of dopamine from intact nerve terminals. Question: what is the mechanism of action of amantadine in the treatment of Parkinson's disease? Answer: weak NMDA receptor antagonism. Question: what is the mechanism of action of ambrisentan? Answer: competitive antagonism of endothelin-1 at ETA receptors only. Question: what is the mechanism of action of aminocaproic acid? Answer: inhibition of plasminogen activation and hence inhibition of fibrinolysis. Question: what is the mechanism of action of aminoglycoside antibiotics? Answer: inhibition of the formation of the initiation complex at the 30S subunit, thereby causing misreading of mRNA, blocking of translocation. Question: what is the mechanism of action of aminoglycosides? Answer: inhibition of the 30S ribosomal subunit. Question: what is the mechanism of action of amiodarone as an antiarrhythmic? Answer: blocks potassium channels, thereby increasing AP duration and effective refractory period. Question: what is the mechanism of action of amoxicillin? Answer: inhibition of transpeptidase, thereby inhibiting peptidoglycan cross-linking. Question: what is the mechanism of action of amphetamine? Answer: increases catecholamine tone by blocking reuptake and facilitating release. Question: what is the mechanism of action of amphotericin B? Answer: binds to ergosterol and forms pores in the cell membrane, thereby creating a leaky membrane. Question: what is the mechanism of action of ampicillin? Answer: inhibition of transpeptidase, thereby inhibiting peptidoglycan cross-linking. Question: what is the mechanism of action of anakinra? Answer: IL-1 receptor antagonism. Question: what is the mechanism of action of anastrozole? Answer: competitive inhibition of aromatase. Question: what is the mechanism of action of antithymocyte and antilymphocyte immunoglobulins? Answer: binding to and destruction of T cells via complement activation. Question: what is the mechanism of action of argatroban and bivalirudin? Answer: direct inhibition of thrombin, factor 2A. Question: what is the mechanism of action of aripiprazole? Answer: partial agonism at 5-HT1A and D2 receptors, antagonism at 5-HT2A. Question: what is the mechanism of action of asenapine? Answer: antagonism at 5-HT2A and D2 receptors. Question: what is the mechanism of action of asparaginase in cancer chemotherapy? Answer: hydrolyzes ASN to deprive cancer cells of the AA. Question: what is the mechanism of action of aspirin? Answer: irreversible inhibition of cyclooxygenase via covalent acetylation. Question: what is the mechanism of action of Atenolol? Answer: selective beta-1 adrenergic antagonism. Question: what is the mechanism of action of atomoxetine? Answer: inhibition of norepinephrine reuptake at the prefrontal cortex. Question: what is the mechanism of action of azathioprine? Answer: inhibition of de novo purine synthesis. Question: what is the mechanism of action of azole antifungals? Answer: inhibition of ergosterol synthesis by inhibiting the cytochrome P450 enzyme that converts linosterol to ergosterol. Question: what is the mechanism of action of aztreonam? Answer: prevention of peptidoglycan cross-linking by binding to penicillin binding protein 3. Question: what is the mechanism of action of bacitracin? Answer: inhibition of the dephosphorylation of bectoprenol. Question: what is the mechanism of action of baclofen? Answer: GABA agonism pre and post-synaptically. Question: what is the mechanism of action of barbiturates? Answer: binds to GABA A receptors and increases duration of chloride channel opening. Question: what is the mechanism of action of benzodiazepines? Answer: binds to GABA A and increase the frequency of chloride channel opening. Question: what is the mechanism of action of beta-lactams? Answer: inhibition of bacterial transpeptidase, activation of bacterial autolysins. Question: what is the mechanism of action of betoxolol? Answer: selective beta-1 antagonism. Question: what is the mechanism of action of bevacizumab? Answer: MAB against vascular endothelial growth factor, thereby inhibiting angiogenesis in solid tumors. Question: what is the mechanism of action of bile acid resins as antihyperlipidemics? Answer: prevent the intestinal reabsorption of bile acids, thereby making the liver use cholesterol to make more. Question: what is the mechanism of action of bisphosphonates? Answer: binds to hydroxyapatite in bone, thereby inhibiting osteoclast activity. Question: what is the mechanism of action of bleomycin? Answer: DNA fragmentation through free radical formation. Question: what is the mechanism of action of bosentan? Answer: competitive antagonism endothelin 1 at ETA and ETB, thereby decreasing pulmonary vascular resistance. Question: what is the mechanism of action of both boceprevir and telaprevir in the treatment of hepatitis C virus? Answer: inhibition of hepatitis C virus NS3 and HS4A proteases, thereby inhibiting the cleavage of hepatitis C virus-encoded polyproteins into their mature form. Question: what is the mechanism of action of botulinum toxin? Answer: inhibits ACE release from nerve terminals, causes flaccid paralysis. Question: what is the mechanism of action of brimonidine in the treatment of glaucoma? Answer: alpha-2 adrenergic agonism. Question: what is the mechanism of action of bromocriptine? Answer: dopamine agonist. Question: what is the mechanism of action of bupropion? Answer: increases dopamine and norepinephrine levels by blocking reuptake. Question: what is the mechanism of action of buspirone? Answer: partial agonism at 5-HT1A receptors and possibly D2 receptors. Question: what is the mechanism of action of busulfan? Answer: cross-links DNA. Question: what is the mechanism of action of calcium channel blockers in the TX of angina? Answer: antagonism of L-type calcium channels, causes vasodilation and reduces cardiac oxygen demand and increases oxygen supply. Question: what is the mechanism of action of calcium channel blocking vasodilators? Answer: antagonism of L-type calcium channels, thereby inhibiting vasoconstriction. Question: what is the mechanism of action of cabergoline? Answer: agonism at D2 receptors. Question: what is the mechanism of action of calcipotriene? Answer: agonism at vitamin D receptors. Question: what is the mechanism of action of capsaicin in the treatment of pathological pain? Answer: agonism at TRPV1, transient receptor potential vanilloid 1. Question: what is the mechanism of action of captopril? Answer: ACE inhibition. Question: what is the mechanism of action of carbamazepine? Answer: blocks voltage-gated sodium channels on neuronal membranes. Question: what is the mechanism of action of carbidopa? Answer: irreversible inhibition of peripheral dopa carboxylase, thereby preventing the breakdown of L-dopa into dopamine at the periphery. Question: what is the mechanism of action of carvedilol? Answer: non-selective alpha and beta adrenergic antagonism. Question: what is the mechanism of action of celecoxib? Answer: selective reversible inhibition of cyclooxygenase 2, which is found in inflammatory cells and vascular endothelium. Question: what is the mechanism of action of chloramphenicol? Answer: blocks peptidyl transferase at the 50S ribosomal subunit. Question: what is the mechanism of action of chlorpheniramine? Answer: reversible inhibition of H1 histamine receptors. Question: what is the mechanism of action of cholestyramine? Answer: bile acid resin, binds bile acids in the GI lumen, thereby causing upregulation of LDL reactors. Question: what is the mechanism of action of cidofovir? Answer: potent inhibition and alternative substrate for viral DNA polymerase. Question: what is the mechanism of action of class 1A antiarrhythmics? Answer: blocks active NA channels, thereby increasing AP duration and the effective refractory period. QT interval elongates as a result. Question: what is the mechanism of action of class 1B antiarrhythmics? Answer: blocks inactive NA channels, thereby decreases AP duration. Question: what is the mechanism of action of class 1C antiarrhythmics? Answer: blocks all morphological forms of the NA channel, thereby significantly prolonging the refractory period at the AV node. Minimal effect on AP duration.
Thank you for listening Dr. Izzy's Medical Podcast Series. If you want to support this project, please subscribe the channel and like this video. Thank you.